Why is bladder cancer recurrence so frightening? Imagine facing a health challenge that keeps coming back despite your best efforts. That's what makes bladder cancer recurrence so unsettling for many patients. Bladder cancer, especially when it involves transitional cell carcinoma, tends to recur quite often. This type of cancer starts in the lining of the bladder and can be non-muscle invasive or muscle invasive. The non-muscle invasive form is more common and generally less aggressive, but it still has a high chance of returning after treatment. One reason recurrence feels so frightening is because it happens frequently. Studies show that between 50 and 70% of people with non-muscle invasive bladder cancer experience a return of the tumor within just a few years. In some cases, the recurrence can happen as early as within the first 2 years after treatment. This means patients often need ongoing monitoring, which involves regular cystoscopies, tiny cameras inserted into the bladder to look for signs of new tumors. These procedures can be uncomfortable and invasive, adding to the emotional and physical burden. Another concern is the risk of progression. While many recurrences are still non-invasive, about 10 to 33% can progress to muscle-invasive bladder cancer. This form is more aggressive and harder to treat. When the cancer invades the muscle layer of the bladder, it increases the chance of spreading to other parts of the body and raises the risk of death. Patients with certain tumor stages or grades are at higher risk for this progression, which makes recurrence even more alarming. The biological nature of bladder cancer also plays a role. Even after treatment, tiny cancer cells can remain hidden in the bladder lining. These microscopic cells can grow back into tumors, which makes complete eradication difficult. This biological characteristic means that even with careful treatment, the chance of recurrence stays high. Living with the fear of recurrence can take a toll on mental health. Patients often experience anxiety about whether the cancer will come back and worry about the impact of repeated treatments. Physically, the repeated procedures can cause discomfort, and the ongoing medical visits can be costly and time-consuming. All these factors combine to make bladder cancer recurrence a source of ongoing stress and concern. There's also the possibility of developing new, separate bladder cancers or secondary cancers elsewhere in the body. This adds another layer of complexity to treatment and prognosis. Because of these challenges, managing bladder cancer involves a careful balance of regular surveillance, timely treatment, and lifestyle adjustments to reduce risk factors. In summary, bladder cancer recurrence is so frightening because it is common, can lead to more serious disease, requires constant monitoring, and affects both physical health and emotional well-being. Staying vigilant through regular checkups and working closely with healthcare providers is essential. Remember, each person's situation is unique, and personalized medical advice is always the best way to navigate this condition. If you or someone you know is dealing with bladder cancer, ongoing care and support are key to managing the risks and maintaining quality of life.